Imagine a healthcare system where patients receive top notch medical services and hospitals have access to skilled and competent nurses, and the staffing shortage becomes a thing in the past. Ladies and gentlemen, I am here today to address the critical issue that is plaguing the healthcare industry in India today. Yes, which is the severe shortage of skilled and competent nurses in the country. And this critical shortage is not only confined to India, this has become the global alarming concern right now. Before pandemic, there was a global shortage of 5 million nurses. However, post pandemic, the International Nursing Council has declared that there is a upcoming shortage of 13 million nurses across the globe. Having put these shortage numbers forward, let me also give you an idea about the reasons why there is a huge shortage, especially here in India. Indian nurses have very less number of trained and competent staff. That is the reason the staff couldn't, thrive in the industry. Second reason being paying very less salaries. That is the reason they are leaving the jobs. Third reason being, increased burden on the existing staff due to the shortages. That is why they are opting out. And the last one being nurses hop from one hospital to other hospital within 6 months or within 1 year just for a minimal increase in the salary. With all these reasons on one hand, the hospitals on the other hand are facing a very high attrition rates. Currently, the attrition rate among nurses in India is 50 to 70%, and the rates are very low. With this, there is also the statistics from Indian Nursing Council that uh, India has 1.96 nurses for every 1,000 Indians, which is much below the World Health Organization recommendation, which is 3 nurses per 1,000 individuals. So, what did I tell you? I have a groundbreaking solution which not only addresses the alarming concern but also revolutionizes the way we see nursing education and employment. And this solution helps the hospitals, nurses, and also, most importantly, the patients that they care for. Welcome to Metavertex. My name is Shiny Charles, and I'm the CEO and founder of Metavertex, where redefine nursing solutions. So, to this alarming concern, we have come up with competency-based trainings and comprehensive staffing. So the main objective of this competency based training is to transform qualified nurses to competent nurses, where we provide training programs where we help them attain certain skills and competencies that are actually required, to thrive in the industry. So once the nurse has completed and acquired those set of skills and competencies, she is ready to hit the ground running. And the second solution is placing these trained and competent nurses in the hospitals based on the tailored requirement of the hospitals. With this, I bring to the vision and mission of Metavertex, where we bridge the nursing skill gaps in the hospitals and empower nurses. There is a huge market potential for skilled nurses in India, which is valued at around 6 billion in 2022 and projected to a reach of 13 billion by 2030. That itself shows the huge market potential. We would like to adopt marketing strategies like, collaborating with nursing institutes for trainings, reaching out to hospitals for the placements, digital marketing activities, referral programs, and partnership with nursing associations. So how does Metavertex stand out from the traditional players? So the traditional staffing agencies, basically the manpower agencies, they do not focus on the trainings as such. They just have a bunch of qualified professionals where they cater to the hospitals based on the requirements. We here at Metavertex, we train them on their practical skills. We make them competent with the required skill sets, so that they can start working in any areas in the hospital like emergency, ICU, OT, etc. And our curriculum is what is the asset. I must say that it we have prepared in such a way that it has the standards of NABH, and it is national board certified as well. And the in-house hospital trainings, yes, there is an induction training of 3 to 6 months in each and every hospital. Every nurse should pass through this. And what they teach in induction training, we teach beforehand, and we give them ready-made nurses. In that way, even the hospitals can reduce their induction duration. That is how we differentiate ourselves from the in-house hospital trainings. Our team has myself, Shiny, and Deepthi, our COO, and the business model where we generate revenues from the trainings, staffing, where hospital pays us as a placement fee, and consulting services where we do a lot of career orientation, career counseling, and certain partnership programs as well. And also through the scalability where we would like to extend our operations based on the increased demands. So initially, to start with, we need a capital of 1 crore to be able to generate a revenue of 1.2 cr with a profitable margin of 34%. So for year one, we have a plan of doing at least 400 to 500 trainings and placing them. So the training fee and the placement fee would together contribute to the revenues. And in the second year two and year three, we have a plan of starting up and setting up another training facility in the southern part of India. uh, and also we will be starting the consulting services from year two and three. So here there's a graphical representation of increase in the revenues and the profit margins for 3 years. So the profit margins will be increased from 34 to 52% to 58% over 3 years period. So whatever the initial capital that is invested will be utilizing mostly for the operations that include salaries, trainings, investing in technology investments, administrative expenses, marketing staff costs, and in year two and three we also have put a training facility costs as well. So this is the model we would like to adapt, where we generate revenues from the trainings and placements, and additionally, moving forward, we will also have a we are also looking at scaling the operations as well. So, ladies and gentlemen, let us join together to empower our nurses and to equip our hospitals with skilled and competent nurses, and let us together build a sustainable healthcare industry in India. Thank you.